This is easy because a lot of what I was going to talk about this morning. And that the person who did some of the things I'm going to talk about is actually here, so you can ask questions of him after I finish. So Walpole, in 2001, in his book, The Great Psychotherapy Debate, made a plea that we contextualize psychotherapy. And he said that the essence of psychotherapy is embodied in the therapist. So I'm talking about therapist effects right now. And that there are some people who have said, Walpole said 6 to 9%. Some people have gone as far as 50% in certain studies and have said that the effects between therapists would even be greater than what you would translate if you had manualized therapy. The study on therapist effectiveness by Krauss, Castelnegay, and et al. In 2011, they looked at a de-identified naturalistic chart review of 696 therapists for therapy outcomes using ratings the first and the 15th session. So that we're talking about 6,960 charts that they looked at. And the domains of change that you mentioned this morning, there were 12 domains of change that they looked at, and I listed all 12 of them here so that you could see what sort of outcomes would have changed by the 15th session. But they didn't look at adult ADHD, eating disorders. I also didn't see anything specific for sexual abuse or personality disorders. So, but these other 12 domains were the ones that they looked at. And the key word in that last slide, of course, is naturalistic. These were not, I don't think there was anything about allegiance in there. That you didn't say what people are, these were real clinicians with real patients. And what was really good about when you pooled all the data was that it improved. There was psychotherapy worked. But when you pull the data apart, in the morning you said the rich, the poor, and the rest of us, that what became clear is that there were certain excellent clinicians with certain categories. And so the takeaway points that I took from reading this article was that 96% of us are effective with at least one domain, and often the one domain that was well taken care of was the domain of depression. But no therapist in this particular study was effective with all the patients, with all 12 groups. And most therapists had at least 5 domains of effectiveness. One of the things that I pulled out that was interesting was that the top-ranked clinician for depression also did very well with social conflict and panic, but his patients with violence and mania tend to worsen. So, you know, that here we have somebody who is excellent in one area, but had problems in another area. Again, this is de-identified, so we don't know who these people are. And that what we may be looking at is a core attribute or an underlying therapeutic skill. And a similar study by Krauss, Castelnegay et al. In 2009 looked at 891 patients treated by 45 therapists who had 4 patients in each group, one with depression and one with mixed depression with comorbid substance abuse. And again, it did not translate across that if you were good in one group does not necessarily mean that you were good in the other group. I mean, there's a lot of sort of clinically intuitive stuff that comes out of there for us, you know, that, and the questions for us, I mean, we can say specialized training for treating violence, substance abuse, and sexual dysfunction came out of both of these papers. And then whether or not we can translate that training making a difference is, I think, part of the research for tomorrow. Now, so we have this generalized look at therapist effects and see these huge therapist differences. But what we look at, what makes an excellent clinician, right? We all sort of have a gut feeling. We meet mentors, we meet people, we hear certain conversations, we think that person has something that I would like to be able to incorporate into my practice. So, I mean, one of the very first who tried to look at these sorts of things was Carl Rogers in his client-centered psychotherapy. And he came up with 3 client attributes: positive regard, congruence, genuineness, empathy. And all are moderate to moderately strong predictors of outcome. You know, that to try and find studies that would try and pull these qualities out. Again, the most studied there is empathy. And that, not surprising, client ratings of feeling understood are better predictors of outcome than observer or therapist ratings. And there's also some evidence that empathy is one of the best skills that a learning psychotherapist can have. That it's especially a more strong predictor for those who are just starting out in the field. And I want to pull out from these 3 attributes, the one of congruence, genuineness, talk about a little bit about that. Because it taps into the therapist's sense of the therapy that they're doing. So congruence can be defined as having an internal facet, which is that the therapist being in touch with their own experience, and an external facet, which means that the therapist's ability to reveal their own internal experience to the client. So that other terms could be transparency, authenticity, openness, honesty, non-phoniness. And but what's there is these are studies that are trying to capture the therapist's experience. I mean, there's a lot of studies capturing the client's experience, and that certainly is extremely valuable. But to look at studies capturing the therapist's experience. So in my terminology and things like the countertransference, right, is looking at the therapist's experience. And this is one study in 2001, Hayes, Gelso, and Hummel, that tried to look at the overview of the literature on both the qualitative and the quantitative literature on countertransference. I must admit that in research terminology, it sort of makes qualitative literature sound pretty dry. Like things like the fact that, therapists who take better care of themselves through meditation, rest, reading, extracurricular activities, that sort of thing, that they tend to have a better outcome. I mean, that's sort of like a one-sentence statement in there, but it's part of, this qualitative research that's out there. And that this particular article looked at 4 definitions of countertransference and operationalized it, and talked about the suggestion that managing your countertransference has a better outcome. And they talked about countertransference management as reflecting self-insight, self-integration, anxiety management, empathy, and conceptualizing ability. So this is a 5-fold way of being able to manage things. So, in conclusion, all therapists have a unique set of abilities, and if they practice within these parameters, then their patients often benefit. Outcome data helps therapists identify domains of excellency, and if they need educational resources, that can be identified for them as well. If we can identify qualities in exceptional therapists that allow them to help the hard-to-reach client, and that first slide that I showed you, remember that was a client population that didn't have identified personality disorders, survivors of sexual abuse, adult ADHD, although they could present with sleep problems, they could present with some of the quality of life problems that may have been captured in the scales that we used. But if we can identify people who can reach these hard-to-reach clients, we can also hopefully identify whether or not we can teach these qualities of excellence.